Good morning. Today we will be seeing about doctor-patient relationship. As an MBBS student, you will be going to clinical posting. So you will be meeting patients. So how to treat a patient? How to talk with a patient? What are the roles that a doctor should have? And how to understand the patient? How to gain the trust of the patient? So these are very important. Apart from only giving drugs and curing, there are other things that a doctor should possess. Then only he can able to have strong bond between patient, he can able to treat properly. So what is doctor-patient relationship? This is a unique social relationship where bonding is planned with the utmost objective of assisting the patient to achieve treatment goals. So a doctor is going to assist the patient toward his treatment. It is not like he is just giving orders. So he will be helping and assisting the patient. So why does it matter? Why? The patient-doctor relationship is fundamental for providing number one, excellent care. Number two, to promote the healing process. Number three, to improve outcome of the disease or outcome of the patient. So how? Suppose in a scenario one, a doctor is sitting and patient is coming inside the doctor's room. And doctor is doing something. He's checking some newspaper or he's in his mobile or he's talking with someone and he's not properly responding. He's just saying the patient, he's signing the patient to sit in the chair. The patient is also sitting and doctor is talking in phone and patient is watching on the roof and down here and there. So after that, the doctor is asking what is your problem and patient is saying I'm having cough and cold and he is just prescribing and sending the patient out. In such case, what is going to happen? There will be a big communication loss. So the care of the patient is not going to be fulfilled. He's not going to know what problem he is having and he's not going to know the outcome of his treatment, side effect of his treatment. Apart from taking drugs, what are the other things we have to know about the disease? So all those things he won't be having any health knowledge. And of course, the treatment is going to, the outcome is going to be poor in such case. Suppose if a doctor is treating a patient that, hello sir, sit down, what is your problem? And ask the patient, I mean, make the patient comfortable in the situation because he is going to come inside and it is a private setup. He is going to open up everything if he feels very comfortable, so he can make that good relationship with the doctor in such a way he can able to say everything about his life. In that case, doctor is going to properly treat the patient and he is going to give health education. So which will be very helpful in case of care, healing process, and also outcome of the disease. Therefore, it is important to understand what elements comprise the relationship and identify those make it good. At the core of the practice of medicine, the patient expects a good relationship as much as cure. So the patient is not only expecting cure. If you see, if you have any experience with patients, you will be knowing that the patient themselves will say, whoever doctor is talking well and listening well, the patient tends to go to that doctor rather than a doctor who is just going to keep his face like without any reaction. If some doctor is there, patient won't go to that doctor. So we are expecting good relationship. Next, doctor-patient relationship itself becomes part of the therapeutic process. So psychologically, there is an effect that puts the patient into the treatment process. So the compliance will be good. So the follow-up of the patient will be good. So if in case if there is any side effect, the doctor can intervene in that area. So the whole process will be therapeutic process is going to be good. Establishing effective communication is the first step in establishing the essential alliance. that will allow the doctor to help the patient. So the first step in this doctor-patient relationship is to establish a effective communication. The capacity to develop an effective relationship requires talking and listening. This is very important because in some case you will be knowing the doctor won't be talking much and the patient is also won't be talking much. In that case, the treatment is not going to be very good. Whereas in some case, doctor himself is going to talk and he won't allow anything to he won't allow patients to talk anything. That is also a problematic scenario. Wherever the proper talking and listening from both the sides, not only from doctor, from patient also. From both the sides, if they are going to talk and if they are going to listen each other, then the progress of the treatment is going to be very good. Then components of doctor-patient relationship. So we are going to create a rapport. What is a rapport? For example, if a patient is coming, we are going to address him, hello, good morning, something like that. Then we are going to ask them to sit. If we feel like the patient is uncomfortable, we are going to make him comfortable and we are going to slowly give an approach. Right? The approach will be spontaneous, conscious feeling. So it is spontaneous, conscious feeling approach for harmonious responsiveness that promotes the development of constructive therapeutic alliance. So we are going to build a relationship with uh, the patient so that which is going to be very constructive therapeutic alliance. It implies an understanding and trust between the doctor and patient. So trust is very important. If the patient is not going to trust you, then he is not going to give any information about his body, his health, and also his social status, other social problem also, right? Doctors like psychiatrists, they have to deal more with their internal problem and external problem also. In such case, they have to gain the trust. So it is important to gain the trust. So the initial step or the starting point of gaining trust is to build an effective relationship. A good rapport should be built. How to establish a rapport? It is by putting patient at ease. The patient will be coming with some fear. Something has happened to him, or he must be having fear about his family. So we have to put him at ease. We have to make him relax, and we have to ask him to sit. Then finding patient's pain and expression compassion. So there is something like sympathy and empathy. What is empathy? Empathy is standing in the shoe of a patient. You have to think like patient. Suppose if you are having the same disease or symptoms or sign, what way you will react? In what way? What are the problems you will face? So you have to think like a patient. Then only you can able to help the patient. Evaluating patient's insight and becoming an ally. So what it is saying, you have to just read the patient, like what is their socioeconomic status and whether they can understand what is their education qualification, what are what are all the knowledge that that patient is having regarding this particular disease. So if you know all these things, then only you can able to help them. Suppose you are going to talk some technical things, but the patient is coming from village. Obviously, he is not going to understand anything. So it is going to be a big communication barrier. Show expertise. Obviously, you are a clinical expert. You will be knowing more things than patient because you are studying in MBBS. You are studying in a college, and you are going to postings and you are learning so many things. So you have to show whatever you have learned. You have to show that while treating your patient. Establish authority as physician and therapist. So establishing authority is needed, but it should be in balanced way. Here it is given balancing the role of empathic listener, expert, and authority. So you have to balance the role of listening, then expertising, and authority. What is authority? To take control of your patient. Control in the sense, not 100% control. It should be a mutual only, but still there should be some point of authority should be there. Like for example, if you want to modify a patient's lifestyle, if suppose if you feel like the patient is smoking more or he's taking more alcohol, he's taking more junk foods, so in that case we have to go an upper hand so that he is going to modify his lifestyle, which is going to be good for him. So this is very important, empathy. So it is intellectual understanding and emotional understanding. Empathy is the capacity of a person to himself into the psychological frame reference of another. So the doctor is going to put himself into the psychological frame of a patient and thereby understand his thinking, feeling or behavior. So the doctor is going to think like a patient and then he can able to understand the patient's feeling. So for example, by looking at the patient, if you feel like the patient is uncomfortable, so you take a proper posture. So sometimes you can able to understand that the way patient is expressing, the way patient is talking, you can able to understand what is happening to him, whether he is understanding or not, whether he is having proper bond with you or not. So such way you can able to treat the patient. So there was one psychologist named Arson. So he was giving some models, like how could be the doctor-patient relationships are, what are all the scenarios that we are seeing in day-to-day life when it comes to doctor-patient relationship. Before moving to that, here he has given some roles. The patient should have some role and doctor also should have some role. What are the roles that the patient should have? Patient must want to get well as quickly as possible. So he should be having the responsibility to come to health center and to say about his complaints and to get treated and go. They should be wanting to get well as quickly as possible. Next thing is should should seek professional medical advice and cooperate with the doctor. So we can see in many cases, patients will be going into quacks. Rather than going to them, the patient himself should seek professional medical advice. Then allowed to shed some normal activities and responsibilities. For example, he has to stop going to his work on that particular day. If he is sick, he has to come to doctor and he has to get treated or examined from the doctor and he has to take rest if needed. If doctor is saying that he has to take rest, then he has to take rest for his betterment of his life. Regarded as being in need of care and unable to get better by his or her own decision and will. Since he is going to come to a doctor, he is going to have that decision making with the help of the doctor. So what kind of problem he is having, what kind of treatment he wants to do, that will be guided by the doctor. So he will be having the decision making also. So what are the roles of doctors that we will be seeing now? A doctor should apply a high degree of skill and knowledge to the problem of disease. So obviously he is learning in his MBBS or MD, whatever it is. So he should apply that skill and act of welfare of patient and, and community rather than for own self-interest. Decide for money and advancement. So the treatment should be patient-centric. It is not for the uh, like he should not go behind money or any self-interest. Then he should be The treatment should be objective and emotional detachment should be there. How? We should not judge any patient's behavior. Suppose in a study clinic, some patients are coming with the uh, study history. You should not judge in any emotional way. You are a doctor, you have to be in neutral in such case, and your aim is only to treat them, help them, and guide them. Be guided by rules of professional practice. So, as a doctor, you have to abide the law. Other rights we have, they are granted rights to examine patients physically and to inquire into intimate areas of physical and personal life. So you are having the grant to examine the patient. Just by taking oral consent, you can ask about, you can deal with that intimate area of physical and personal life in a view of treating the patient. Then granted considerable autonomy in professional practice and also occupies position of authority in relation to the patient. So here we are going to see about different types of doctor-patient relationship. So here you can see in this column we are saying patient control, low patient control, high patient control. Here in this role we are saying physician control, that is low physician control, high physician control. So these are the four types that we have here. One is default, number two paternalism, number three consumerism, number four mutuality. So what is default? When there is low control from physician, low control from patient also. What is control? Taking an authority or being responsible for that patient or doctor. So the physician is also not taking any authority of this patient. Patient himself is not also taking any control over him. So in such case, it is that is what we are going to call as default. So another thing is paternalism. Here, the control will be uh, more by doctors. The patient is going to have no control. In this case, what is going to happen? Doctor is going to put that upper hand. Whereas in consumerism, patient is going to take the control, then doctor. We have mutuality. In mutuality, both doctor and patient, they are going to equally talk and going to be hand in hand in treatment process. The paternalism, this traditional doctor-patient relationship. This was in back then in old age. They started with paternalism. The doctor is going to give orders that patient have to do. So patient will be submissive. There are some disadvantages in this. Why? The patient is not given proper time. The patient is not going to speak anything. So the doctor might miss that important key points in the patient's history or about patient's health. So he is going to talk only about him. I mean, whatever he is having in his mind, he will ask questions according to that disease only. He will miss other diagnoses also. But there are some advantages are there in paternalism, that is placebo effect. If doctor is going to use the placebo effect, then sometimes there is chance that it is going to work for the patient. Then mutuality. In mutuality, both doctor and patient, they are going to have the upper hand. So they are going to talk more, they are going to open more, and in such way they are going to easily communicate. In that case, there won't be any miscommunication. There is not going to be any barrier, and each will understand about each other's problem. The doctor will give proper health education. The patient is going to follow everything. In such case, it is going to increase the outcome or treatment of the patient. Consumerist. So, in modern days, this concept is going right. We can easily see this is rising. Right? Here, the patient is active. Patient is going to take the active role. and he will be treating doctor as like I am paying for you and you have to work for me. That kind of opinion will be coming in this scenario. You can see here this green color person is doctor and you are this blue color person is a patient. So this is that default. You can clearly see that the patient is also not having any interest. This doctor is also not having any interest. Just like for namesake, he is giving some drug. In this case, the relationship is not going to be good. Might be he may not come or next time also. Like follow up visit, he may not going to come. So these are about for passes model. Here we have other models also. That is informative model. In this model, doctor is going to act as a person who is going to give information, but still the choice is left only up to the patient. Maybe appropriate for certain one-time consultation. In one-time consultation, it is okay, but then doctor likely to be perceived as a cold and uncaring. Deliberative model. Here, doctor is going to act as a friend. Not only he is going to give information about the disease and everything, he is going to act as a friend or a counselor to the patient. In this case, it is going to be like the concept of mutuality. The patient is going to gain more advantage in this. Then, what are the types of consultation type? There are different types of consultation style. One is doctor centered, other one is patient centered. Doctor centered is mostly paternalistic consultation type, right? The doctor is the expert and patient expected to cooperate. So whatever the doctor is saying, that patient has to do. Then tightly controlled interview style to aim at reaching an organic diagnosis. So the doctor is going to think only about an organic problem. He is not going to think other than the organic problem, his social factor, any other ethnic problem, like social demographic profile, he is going to forget about the patient. And he is also going to have, or he is going to put that closed question. Whether the patient will be saying only yes or no, whichever question the doctor is going to ask, the patient will be having only these two options. He won't be having a time to think or reveal all of his problems. So the voice of medicine focus on biomedical diagnosis and treatment as quickly as possible. Then another one is patient centered. This comes under mutuality concept where less authoritarian will be there. It encourages patients to their own feelings and concerns. So here, the paternalism is not going to happen. So the open questions will be given to patient so that the patient can talk more about their illness and patient is going to open up and doctor can listen more and he is going to get more information from the patient. The voice of the patient, communication of patient's belief, feeling, and psychosocial context. So there are various factors that is going to intervene or modify doctor-patient relationship. So one is we are going to see from patient side. One is age. If the age of the patient is less, suppose he is pediatric patient or he is geriatric patient. If he is going to be more than 55 or 60, understanding about the disease is difficult. In pediatric patient, they won't be having much knowledge. In geriatric patient, they might be having like Alzheimer's, so they can able to tend to have memory loss. In such case, the doctor-patient relationship is going to have some problem. Then, social and education level. If the patient is not having proper literacy, proper occupation, proper education, then he's not going to understand what doctor is going to say. Then doctor will be saying something and he's going to say other thing. Then languages. If you see languages, suppose nowadays in India, people are coming and studying from different part of the India. So it as India is a diverse country, we are having different languages. So whenever the people are going to come from outside of that particular place, so the local people cannot understand what that doctor is going to talk. Suppose if he is going to talk in English, of course they cannot able to understand. And also initial period for that MBBS student of that doctor, it will be difficult for understanding the local language also. In that case, there will be a big communication barrier will happen. Then membership of an ethnic minority. Suppose if the patient is coming from a small minority group, then he is not going to open. There also the doctor-patient relationship is going to have some problem. Then doctor-related factors, training in communication skills. If the doctor is not going to have proper communication skills, even though he is knowing everything about the disease. He is having all knowledge about the disease. He know what drugs to give, but he is not having the communication skill. Then he is going to be a failed person in his in treating the patient. Then self-confidence in ability to communicate. He should be having that self-confidence to uh, not to take authority, but to have the relationship with the patient. Then his personality and psychological factors. Suppose if he is having a bad day on the particular day, so he's not going to be very open, or he's not going to be very neutral. He's having some stress which reflects in his treatment towards the patient. So that is going to stop the good doctor-patient relationship. So to take a very good history from patient, or to listen and talk and listen and get information from the patient, the interview setting should be in a comfortable surrounding. For example, adequate privacy should be given, because the doctor is going to the patient is going to open up about himself, his personal things. So proper privacy should be there, and comfortable surrounding should be given, and appropriate sitting arrangement also should be there. So other than that, he should feel good, and the trust should be built between the patient and doctor. Then only he can able to freely talk and inform about him to his doctor. So there is something like health literacy. It is the ability to obtain, process, and understand basic information and services needed to make appropriate health decisions. So, in simple way, that in what how the patient is going to understand about his disease, or what are the understanding or knowledge he is having about his disease. So, if literacy is low, it will be different for the patient to understand about his health problem. So, when a patient is going to talk with doctor, for example, he is going to a patient and doctor both are sitting and they are discussing about their disease, the patient's disease. So in that case, what are the things a patient should ask before asking any question about his health? He has to have these three questions. These are ask me three questions. Number one is, what is my main problem? What do I need to do? And why it is important for me to do this? Then only he can able to focus on his problem, and he can inform the two doctor. Otherwise, he will be deviating from himself, and the communication won't be good. So here we are going to see some common errors that the doctor is going to do. One is, doctors do more talking than listening. Then doctors often ignore the patient's emotional health. Then doctors underestimate the amount of information patients want. Then doctors who cannot communicate are more likely to end up in court. That we are seeing that the talking and listening should be very important in case of any communication. Then patient emotional health is also very much in that. That is, doctor should have empathy over the patient. Then doctor should always say everything about the disease to the patient. If suppose he is thinking that the patient is not having that understanding and that capability to understand whatever he says, he should not stop saying things. He should say in a way that the patient can understand. And if there is no proper communication, as we are seeing that around India, there are so many times that there is quarrel is happening among doctors and public people. So to avoid that, we should have proper communication and between the patient and doctor. So summary, these are the things that patient and doctor have to, doctor have to do. Yes, active listening, then non-verbal communication, and doctor should have his proper agenda, and doctor should empathize, and you should be having proper skill in educating patients. He should give reassurance. This is very important. He should give reassurance. Then agreeing on a treatment plan that we have to give treatment opportunities, options, treatment options to the patient. And whatever the plan that patient is going to take, then there should be some agreement should be there. Then he should take responsibility of the patient and he should avoid overreacting. The doctor should be neutral. He should not go behind any his feelings. Establishing boundaries. So these are the minimal requirement that a doctor should have while treating a patient. So this is about today's doctor-patient relationship class.